A major component of my practice is devoted to hernia surgery. So groin hernias, ventral hernias, which is other hernias of the abdominal wall, as well as hiatal hernias. Gastroesophageal reflux disease, or GERD as is commonly known, is another area of my expertise. We offer many different therapies for management of GERD, including minimally invasive and endoscopic procedures to help patients with reflux. Well, we see patients come into the office kind of with all different states of mind when they're first considering bariatric surgery. A lot of our patients know that that's something that they want to do and they've been thinking about it for a long time. We also have some patients that are kind of coming for the first time and really is new to them. So I really like to sit down with the patients and walk them through all the options available. The most common procedure that's done these days for weight loss is the sleeve gastrectomy, but we also offer the gastric bypass and the biliopancreatic diversion, also known as the duodenal switch. It really is just dependent on the patient's individual preferences as well as their medical history. We work together to come up with the best plan for them and the best procedure for them moving forward. What really gives me satisfaction in my field is the ability to see a patient at a preoperative visit, really sit down, talk to them about their medical history, about their problems, and then being able to have a really immediate impact on their quality of life. And it's very rewarding for me to see that patient back in clinic, whether it's 1 month after surgery or 1 year after surgery, and just see how dramatically different their life can be and how much better they can feel on an everyday basis.